COVID-19 surges again in mainland China. Omicron XDV and NB1 8.1 variants drive new wave amid concerns over transparency and public trust in May 2025. COVID-19 has once again surged in mainland China, drawing widespread attention both domestically and internationally. According to recent reports and discussions on social media, particularly the X platform, the Omicron XDV NB1 8.1 variants are spreading across multiple regions in China, triggering a sharp increase in infections and placing heavy pressure on the medical system. Meanwhile, the transparency of official data, the effectiveness of response measures, and the public's trust in authorities have once again become focal points of public debate. Multiple posts on X indicate that since May, COVID-19 positivity rates have risen significantly in several regions, including Shanghai, Shenzhen, Beijing, Shandong, Hubei, and Jiangxi. Official data shows that the national positivity rate in sentinel hospitals reached 16.2% in May, double that of April. The peak of the outbreak is expected to arrive by the end of the month. Some users revealed that hospital outpatient departments are overwhelmed, with patients exhibiting severe symptoms such as razor blade throat, and even cases of death have been reported. However, some hospitals are allegedly not classifying the cause of death as COVID-related, sparking external concerns over the accuracy and transparency of official data. On May 26, Chinese Communist Party CCP epidemic expert Zhong Nanshan stated that from late March to early May, the national positivity rate doubled, and the number of hospitalizations had clearly increased. However, no specific figures on infections or deaths were made public. This aligns with user reports on X, where many netizens through VPNs have shared videos showing packed hospitals, painting a grim picture of the outbreak. In contrast, official media maintains a cautious tone, emphasizing that the situation is under control, a narrative that starkly contrasts with public perception. Furthermore, discussions on X point out that the current outbreak is driven by the Omicron XDV and NB1 8.1 variants, which exhibit strong immune escape capabilities. This may be related to the waning effectiveness of previous vaccinations and ongoing virus mutations. Notably, some posts mention that after the recent spike in infections, authorities made a rare admission of the serious situation. Experts speculate that AI-based outbreak models may have predicted that the situation would be too big to conceal, prompting the government to disclose partial information ahead of time. However, without detailed supporting data, the public is left in the dark regarding the full scope of the outbreak. Recently, there have been online reports claiming that trucks at a construction site in Pudong, Shanghai, were sealed off again due to epidemic control measures. Truck drivers were reportedly barred from exiting their vehicles. This news sparked concerns among netizens that China's notorious zero-COVID lockdown strategy might be making a comeback. According to videos and screenshots posted on X by the user, No King No Emperor's Oxy Special Forces on May 22, a truck at a Pudong construction site was sealed on May 21, 2025, and the driver was not allowed to exit the vehicle, confirmed to be for epidemic prevention. The video shows what appears to be a male driver filming from inside his truck, with a red lettered white seal posted on his door that reads, "Strictly forbidden to exit vehicle." Below the seal, the date May 21, 2025 is clearly visible. The driver says, "In Pudong, Shanghai, they're starting to seal trucks again, not allowing us to get out. I don't even know if what they're doing is legal." A screenshot also shows someone speculating whether this was due to entering a hazardous zone or failing to meet safety equipment requirements. The video uploader responded, they said it's due to epidemic prevention. The rapid spread of this new wave is putting China's medical system under severe strain. Based on videos and accounts from ex-hospitals in cities like Shanghai and Shenzhen are overwhelmed and medical resources are stretched thin. This is even more concerning in rural and underdeveloped areas where healthcare infrastructure is lacking and the impact of the outbreak could be significantly worse. Experience from previous outbreaks shows that China's healthcare system tends to suffer from uneven resource distribution during crises. For instance, after the lifting of restrictions at the end of 2022, some regions experienced extreme medical shortages. It remains to be seen whether lessons were truly learned from those episodes. Additionally, some users on X allege that certain hospitals are deliberately avoiding listing COVID-19 as the cause of death, possibly to avoid triggering funeral subsidy payouts or public panic. If true, such actions would not only undermine data transparency but also further erode public trust in medical institutions. The healthcare system's capacity to respond effectively depends not just on hardware and facilities, but also on transparency, efficient resource allocation, and public communication. At this point, China urgently needs more agile emergency mechanisms, such as rapidly deploying temporary treatment sites, optimizing vaccination strategies, and ensuring a sufficient supply of medicines. Transparency of data has long been a controversial issue in China's handling of COVID-19. Many users on X have questioned the authenticity of official figures, suspecting that actual infection and death rates are far higher than those reported. For example, some netizens claim that deaths in Shanghai and Shenzhen are being underreported and that authorities are downplaying the severity of the outbreak. These suspicions are not without precedent. Over the past few years, Chinese COVID-19 data has repeatedly been accused by international observers and independent media of selective disclosure. A report by Vision Times noted that Zhong Nanshan, while commenting on the outbreak, did not provide any specific death toll, further intensifying public skepticism. In today's globalized world, the transparency of epidemic information affects not only domestic decision-making but also how the international community views China's pandemic response. A lack of transparent data can reduce public compliance with health measures and may even trigger panic behavior such as hoarding medication or refusing testing. The emergence of Omicron XDV and NB1.8.1 highlights the ongoing challenge that virus mutations pose to vaccine effectiveness. Although China aggressively promoted vaccination campaigns in recent years, many users on X have expressed doubts about the protective effect of existing vaccines. Experts have pointed out that enhanced immune escape by these new variants could undermine the efficacy of current vaccines. This situation calls for China to accelerate the development and distribution of updated booster shots, specifically targeting new variants, and to increase vaccination coverage, especially among high-risk groups such as the elderly. Moreover, some users on X have mentioned terms like a vaccine disaster, and so-called remedies like artemisinin derivatives, e.g., artesunate. While these claims lack scientific validation, they nonetheless reflect public dissatisfaction with official prevention and control measures. The spread of such misinformation could further erode vaccine confidence. It is critical for the government and scientific community to strengthen public education, dispel rumors, and use credible scientific data to convince the public. Over the past few years, China's epidemic control policies have shifted dramatically from zero COVID to broad relaxation. The current resurgence has reignited debate over whether the dynamic zero policy is still necessary. Some posts on X criticize the authorities for delayed responses, such as in Beijing, where officials allegedly failed to take timely measures during the early stages of the outbreak, leading to rapid virus spread. However, overly strict lockdowns risk reviving economic stagnation and fueling public discontent, a dilemma that the authorities must now carefully navigate.